Why doesn't the United States have universal health care as a right of citizenship? The United States is the only industrialized nation that does not guarantee access to health care as a right of citizenship. 28 industrialized nations have single-payer universal health care systems, while one, Germany, has a multi-payer universal health care system like President Clinton proposed for the United States. For Joe Segal, it was the day he was kicked out of the hospital on an IV after knee surgery without insurance and with $100,000 of medical debt. For Kiki Papard, it was having to postpone needed surgery until she could find a job with insurance. It took her 2 years. For Alan Horton, myself, it was the fact that I pay over $250 a month in health insurance for 2 different policies because myself and my son have pre-existing conditions that my employer's insurance company will not cover. While at the same time, people who do not work get free health care, but people who work do not. People all over the United States are waking up to the fact that our system of providing health care is a disaster. I'm going to attempt to make a case for why there should be universal health care in the United States. Number 1, rising health care costs present a need for universal health care. Over the last few decades, the United States has witnessed skyrocketing health care costs. Health insurance premiums have been rising on an average by double-digit percentage points over the last 5 years, a rate of increase that is 2 to 3 times the rate of inflation. Because of these out-of-control health care costs, there has been a steep rise in the number of uninsured Americans. Currently, more than 45 million Americans lack any form of health insurance, and millions more are underinsured, which means that they have insurance but lack adequate financial protection from health care costs. Number 2, employers cannot afford to provide health insurance for their employees. In the face of rising health care costs, fewer employers are able to provide their workers with health insurance. The percentage of employers offering health insurance dropped from 69% in 2000 to 60% in 2005. Even if employers are able to provide health insurance benefits, the trend is towards providing high-deductible insurance that covers an ever-shrinking percentage of health care costs. The net result is that more and more employed middle-class Americans find themselves with low quality or no access to health care. Number 3, more and more Americans want universal health care. An ABC News and Washington Post poll said that Americans by a 2-to-1 margin, 62% to 32%, prefer a universal health insurance program over the current employer-based system. Support for change is based largely on unease with the current system's costs. 78% are dissatisfied with the cost of the nation's healthcare system, including 54% very dissatisfied. According to procon.org, 77% of Americans say that they think that health care should be a right. The U.S. Census Bureau reports that 46.3 million people in the United States are uninsured. According to allbusiness.com, nearly half of all bankruptcies in the United States are related, at least in part, to health care expenses. And of those facing medical bankruptcies, roughly 3/4 had health insurance at the onset of their bankruptcy illness. Under the current system, the widespread lack of adequate health care is estimated to cost the economy $60 billion to $130 billion a year. Let's discuss some of the myths surrounding universal health care. Myth number 1, the United States has the best health care system in the world. Wrong. The United States ranks poorly relative to other industrialized nations in health care, despite having the best trained healthcare providers and the best medical infrastructure of any industrialized nation. Myth number 2, universal health care would be too expensive. Wrong. Single payer universal health care costs would be lower than the current U.S. system due to lower administrative costs. The United States spends 50% to 100% more on administration than single payer systems. By lowering their administrative costs, the United States would have the ability to provide universal health care without managed care, increased benefits, and still have money. Myth number 3, universal health care would deprive citizens of needed services. Wrong. The U.S. denies access to health care based on the ability to pay. Under a universal health care system, all would have access care. There would be no lines in other industrialized as in other industrialized countries due to the fact that we have an oversupply of providers and infrastructure, and the willingness and ability of the United States to spend more money on health care than any other industrialized nation. Myth number 4. Universal health care would result in government control and intrusion into health care, resulting in loss of freedom of choice. Wrong. Single-payer universal health care administered by state public health care system would be much more democratic and much less intrusive than our current system. Consumers and providers would have a voice in determining benefits, rates, and taxes. Problems with free choice and confidentiality and medical decisions making would be resolved. Myth number 5. Universal health care is socialized medicine and would be unacceptable to the public. Wrong. Single-payer universal health care is not socialized medicine and would be preferred by the majority of citizens of this country. Myth number 6. The problems with the U.S. healthcare system are being solved and are best solved by private, corporate-managed healthcare medicine because they are most efficient. Wrong. For-profit managed care cannot solve the U.S. healthcare problems because healthcare is not a commodity that people shop for, and the quality of healthcare must always be comprised when the motivating factor for corporations is to save money through denial of care and decreasing provider costs. In addition, managed care has introduced problems of patient confidentiality and disrupted the continuity of care through having limited provider networks. Now let's revisit the main points of this subject. In conclusion, with the ever-increasing health care insurance costs, the lack of coverage for millions of Americans, and the fact millions are denied access to health care under the current system, the United States must adopt a universal health care system. It is indeed acceptable to deny health care based on the ability. Is it indeed acceptable to base health care on the ability to pay? No. Or is health care a basic need that should be provided to every American as a matter of course? If the answer is yes to the latter, then we need to overcome the remarkable inertia of the American healthcare system and create a society in which healthcare is available to all. The healthcare overhaul will extend coverage to 30 million people who are uninsured, or as Walmart calls it, our employees.